Hello everybody, it's Zoe. Welcome to another live Q&A. Tonight what we're going to talk about is what to do when we're at the 5-year post-op mark, because I've had a lot of questions about this recently, and Bernadette was the one who suggested this topic, which I thought was a great topic because often we talk about kind of long term but we don't really nail in on the long term. So if you are watching the replay, just skip forward a few minutes. I'll just have a chat to those who log in. If you have logged in, say hi. I can see that you're here, but it hasn't shown me who that is yet. And we will get started in a couple of minutes. We're going to talk about a few things to do with sort of long-term post-op, what we kind of need to do. So in terms of what some of the statistics are around weight regain, what to expect, and also having a look at what we can do about weight regain or to prevent weight regain in the long term. So that will all be coming up. All right. I'm just getting up the questions that I had on the post that I put up yesterday in the comments. We've got quite a lot, and everybody seems to be in a similar kind of boat at the moment too. So hopefully this will be helpful. In terms of what's coming up for the group, I might just talk about that while we wait another minute, just for somebody, a few more people to log on. We have you're going to have a new meal plan come up in the next week or two. I'll turn this live Q&A. There will be a blog coming up as well, and a few other bits and pieces. We've got some, I posted actually the other day a resource with like tips to survive silly season. I know silly season might be a bit different this year, but I thought that was really kind of pertinent given we are hurtling towards the end of the year. Oh, it's Jenny and Katya. Hello. Katya, long time no see. I hope you are well. Thank you for posting your question too. I'll get to that in a minute as well. So I'll just read out a few of the comments because I think they were really interesting, and we'll get started. But I thought they were interesting because everybody was telling me the same sort of story, or there was a definite theme in the comments. So my question to you was, I'm doing a live Q&A around life after surgery in the long term. What do you want to know? What questions? So Victoria sort of said, you know, she's had a lot of health complications, and she had all of these sort of different things that she was dealing with, and kind of figuring out how do I manage that with, on top of having the bypass, the sleeve. And Sim had said she was 3.5 years post-op, lost 42 kilos in the first year after surgery, gained 4 to 5 kilos this year. And I think Beck was sort of similar. It's like, add me to the 3-year, 5 to 10 kilo oh hell club. Unsure how to manage it. It seems insidious and somewhat inevitable when you've struggled with weight all your life, and that's so scary. And Jacinta said the same thing. She's up 2 kilos. And is it a pipe dream to get sort of 5 kilos off? Jenny's 5 years post-op, gained about 10 kilos back. So I wanted to first of all say that you're not alone. I think Katya, you said as well, you're 4 years now. Can't believe it's been 4 years. And about 10 kilos of weight regain. And is it okay to do Optifast or not? Is it worth it? And I wanted to kind of lay out some of the statistics that we have around the sleeve surgery in the long term, first of all, because I think it's important that we understand that it is common to have some weight regain. What we have in terms of the data long term is I mean, ideally we'd have more, but we really don't, and we have a couple of reasons for that. We have a few studies now that are looking at up to 5-year post-op data, and very few, but a few looking up to 10 years post-op data. And what they're all sort of saying is that around that 55 to 57 to 60% of excess weight lost is really consistent with a sleeve. So that means where you were when you first had, before you did the pre-op diet, and where you are now, where you would be at a BMI of 25, what is that difference? And then you figure out where you are now as a percentage of that difference. So if you have, let's say you have 40 kilos to lose and you lose 30, then you're at 75% of your excess body weight that you've lost. So it is really still looking like it is a successful and a viable surgery for long-term weight loss, because what we don't tend to see is people gain back all of that weight. However, what you can definitely see in the statistics is that over time there is a little bit of weight regain, and that's normal. Now, the problem that we have with the data is that the follow-up numbers really decrease the longer we go after surgery. Now, that could be that we have a whole bunch of people out there who are living perfectly happily, no weight regain at all, and they're having a great old time, and so they don't see the need to go back in for their post-op follow-up appointments in the long term. So we're talking, there's usually a big drop off after about 2 years. However, there could also be the people out there who are not going back in because perhaps they've regained weight and they're feeling embarrassed, or helpless or hopeless, or all of those kind of emotions. Maybe it's difficult to get back in to see your original surgeon. There's lots of reasons why people might not follow up, but it does make it really difficult for us to know exactly what's going on long term after the sleeve. There also seems to be a few reasons why people might regain weight afterwards, and so I wanted to talk about a few of these. I think it's really important that if you do feel like you're starting to regain weight, whether that's in the 3-year club or the 4-year club or the 5-year club, that you get back in and you see that surgeon, because the first thing we want to do is rule out an anatomical reason for the weight regain. So for example, if the sleeve has stretched a little bit, then we need to know that that's there. So often the surgeon will do a swallow and just have a look at what size the sleeve is, and how it's functioning as well. So Jenny sort of had some reflux and so has been back in to see. I was talking with another client the other day and she went back in and she actually found it really reassuring to do a swallow. So she was experiencing the similar thing with reflux, found it really reassuring to go back into the surgeon, do a swallow, and for him then to be able to say, no, you haven't stretched it, it's still there, it's still working. And that just really helped with her mindset, I guess, less anxiety and panic and stress. So please go back in to see the surgeon to rule out any anatomical cause of the weight regain first. The second thing that I would do is go back in to visit your GP to rule out any medical reason for the weight regain. Is there something else going on with hormones? Is there something else going on with medication? Is there something else going on with your bloods? Are you feeling exhausted because you've got an iron deficiency, which means that then you can't exercise? Because that's going to end up with a big kind of flow-on effect in terms of your lifestyle behaviours. And there are other options. Whilst, we talk about often using, say, revisional abdominal surgery. We don't necessarily need to jump straight to having a bypass if you're regaining some weight. There are some other options. There's a medication that was approved in 2019, last year, for use in Australia called Contrave, and that has been used quite successfully to help control appetite and cravings. And so if we find that a patient has long-term got some of their appetite back and they're struggling with that ghrelin, that little gremlin, then it can be really helpful to try something as an adjunct therapy. So try something like the Contrave and see if you get results with that as well. I think the most important thing is that we actually take a moment to reflect and look at what are we doing in terms of those lifestyle behaviors, because it is so easy to forget or to be really strict with yourself and really motivated in the first 12 months or so, and then either forget or just slowly kind of slip back into some of those old habits. And I've been working with another client recently who is similarly around the 5-year, 6-year mark. And when we started talking about some of those basics around what we needed to do in terms of habits after a sleep, she was like, oh yeah, I forgot about that one. Okay, I forgot about that one. So being able to kind of talk about that with someone, and whether that's your dietitian or your surgeon or your GP, I think it's really, really important, because reminders like that will help you to go, oh, that's what I used to do straight after surgery. Because it's like anything, if you get used to it, sometimes you don't even notice that slow change is occurring, and then you kind of sometimes just panic and automatically go, well, do I need to do something really restrictive like Katja with the OptiFast? Should I do OptiFast? It's a really valid question, but often there's lots of things that we can check first. Okay, I think it's also important just to remember that once you have obesity, it's a chronic, it's a multifaceted condition, and it's something that has to be managed in the long term. So whilst the sleeve or any sort of weight loss surgery is a good option, it is only one option, and you need that team, you need that support to keep fighting that obesity in the long term. And don't feel embarrassed to go back in. Everybody regains some weight. And actually, I should have sort of said that at the beginning. It's quite normal to have a little rebound. But what we don't want to see is that rebound of, say, 5 kilos or so just keeps creeping up, because that's when we want to try and nip it in the bud and stabilize that weight. And sometimes it might be that you need to have a frank discussion with yourself or with one of your support people around, what are my expectations, and are they realistic? Is this where my body wants to be? So who was it that was talking about, hang on, let me find it. Jacinta, and Jacinta had said, I'm up about 2 kilos overall. I still have in my mind I'd like to get 5 to 10 kilos off. Is this a pipe dream? And it might be, Jacinta. The fact that you're maintaining and have only put on 2 kilos long term and sort of maintaining a stable weight is really positive. And sometimes we don't give ourselves enough kudos, I guess, for actually achieving that and keeping it fairly stable. And it's also normal, it's normal for people of all sizes, regardless of whether they have had struggles with their weight in the past or not. It's very normal for weight to fluctuate a little bit over seasons, over the time of the month, over, depending on whether or not you've been exercising. And so it's kind of wrapping your head around the fact that it's okay to go up and to go down a little bit, and it's not the end of the world, but we just need to be mindful that doesn't just kind of go up and up and up. All right. So I'm just going to go back and have a look at some of your comments. Any questions, pop them in, please, and let me know. Jenny, you've put some comments in there. Yeah, so up about 10 kilos. However, Jenny, you had lost 30, this is my maths, no, lost 40, and so you still maintained a loss of 30 kilos. And I think that's also something to keep in mind. The research does say that it's very uncommon for people to regain all of the weight that they lost with the surgery. So usually we are maintaining at least 50% of that excess weight loss, but often more than that, up to sort of 60 to 70% of that excess body weight. And so give yourself a big pat on the back for what you have managed to lose and keep off, but also be quite frank and honest with yourself about what some of those habits might be that are creeping in, and do that investigation around the medical and the anatomical side of things as well. We've also had Sam log in, Emma log in, Rianne log in, and you're slowly going down again. That's awesome. And it is possible to slowly go down again if we can reevaluate what habits you are kind of maybe have drifted back into, or if we can look at some of those adjunct therapies, then it is definitely possible to lose some weight again. It just will never be as fast as it was in the initial kind of honeymoon period, the first 12 to 18 months post-op. Okay. Jenny, I found the first couple of years effortless, and so never really established the right habits. I also find it really difficult to motivate myself to exercise. And absolutely, I think this is so important that we, and it's hard now if you really didn't kind of need to focus on those habits too much in the beginning, or didn't really form those habits too much in the beginning. But there's always time to work on behavior and to work on those habits. So I think have a look at what some of those habits should be post-op, and even do like what we were talking about with doing a sort of a back to basics reset. So rather than Katya going on to the OptiFast, doing a habit check, having a look at what you've been doing, what you've kind of crept into, if there's anything there that you can identify. I always say pick only 1 or 2 or 3 things max that you want to focus on, because if you try to do a big overhaul of everything all at once, it often kind of falls over. So I would definitely suggest we just do 1 or 2 or maybe 3 habits at once, and then work on that. So some of the biggest things that I see, I think, in people that are regaining weight or struggling with those habits in the long term, they are grazing. All right, and they might be grazing because they're thirsty, they might be grazing because it's around, they might be grazing because they've just spent 5 months in lockdown in their kitchen, they might be grazing for all sorts of reasons. But look at that if you find that you're just kind of grazing, and that's that non-hungry eating where you're not physically hungry. That's a really, really big one. Not enough sleep, a lot of stress, not enough exercise, or the portion sizes, back to the food, the portion sizes and the speed of eating has increased a little bit. So even if you started to go, okay, well, I'm just going to, for a week or 2, just be aware of what I'm doing. That is a really good place to start. I think that's really, really important. Awareness is always the first step, and then we can start to look at how we might change some of those habits and what we might do. And Rianne, lots of exercises helped with that weight to come off. Absolutely, that's awesome. So you are back down almost to your lowest weight, which is really good. And Beck, I get it, I feel you. That creep is so scary. Absolutely, and especially if you've had that history of struggling with your weight and going up and down and doing all of those diets and yo-yoing left, right and center, it is so scary. And I think we sometimes, like that's when I was explaining around that patient who had a swallow done. To her, that was really, really comforting to know that the sleeve was still there, it's still working, and so she could release that little anxiety and then focus on the next thing. And so I think trust the process, trust the surgery. If you're still getting portion restriction, if you're still feeling uncomfortable after you eat certain foods, if you're still having to slow down, or you feel uncomfortable after you have eaten a bit too quickly, then you know the sleeve is there and it's doing its job. You've just got to listen and look at mixing it up too, because your body gets used to how much food is going in and how much exercise or how much calories are going out, and so you might need to focus on the exercise. And talking about exercise as well, that muscle building exercise is really important, because I know this, I talk about this a lot, but the more muscle we have, the more calories we burn at rest, so the higher our metabolism is. And after surgery, you lose not only fat, but you lose muscle, because you can't lose a significant amount of weight without losing some muscle. And so it actually decreases the metabolic rate or our metabolism. And so what we need to try to do is to build as much muscle as possible, so that we can really get that metabolism or that metabolic rate up as high as possible, which means that we're burning more calories at rest, rather than just always restricting our food. Okay, because that gets miserable after a while. There's also some really interesting research, and I've tried to find it before, but it was spoken about at a conference that I went to last year, and I asked to see if I could get my hands on it, but I couldn't. And so I'm still searching for it. However, what this speaker was talking about is with going back onto meal replacement shakes long term after surgery, it can actually ramp up your appetite hormones again. So it's like it almost goes back into that starvation mode. And what happens when we go into starvation mode with any restrictive diet, this is excluding with the surgery because it's a little bit different with the surgery, but with any other restrictive diet before surgery, anytime you restrict like that, your body's reaction is, oh gosh, I don't want to die, so I'm going to force you, I'm going to ramp up my appetite and I'm going to slow down my metabolism so that it forces you to go in search of food. Now, what this research that she was talking about in post-op patients was that when they went on the Optifast after surgery, so this is about 12 months after surgery, they actually got an increase in their appetite hormones, and it undid the work that the surgery had done to dampen those hormones down. So that is something to be very careful of. I still don't mind recommending, a meal replacement shake for 1 or maybe even 2 meals a day if it's convenient for you, but you have to feed your body well. It has to be, nutritious, and going back into severe restriction again is likely going to be unhelpful in the long term. It brings on that diet mentality again as well, where, we're restricting and putting those rules back in around food, which make it not very fun for everyone. All right, so Beck, you've said absolutely still unable to eat like a real person, still eat like a sleeve person. That's fabulous. So Beck, to me, if you've still got that sleeve there, I know you're worried about a little bit of weight regain, but be kind to yourself. You guys have just been locked up in your house for, 5 months, 6 months maybe? So I would absolutely not be surprised at all if you had gained a little bit of weight over that time. So look, give yourself a break, see how you go now that you're able to get back out and about, and see what happens over the next couple of months. Because I think most of you will find that once you can actually start moving more during the day, and we're not perhaps locked up at home quite so much, that will help a lot. All right. Bernadette, hopefully I have answered your question, I think, about what success looks like at 5 years. I think you were going to try to log on, but perhaps we're working, so I will let me know when you watch the replay if I haven't answered that question. 7 months, goodness, that time has flown by, you guys down there. You have done amazingly well. I feel for you. And look, I think both of you, Jenny, and I'm just watching the chat between Jenny and Beck saying 7 months and 5 kilos with COVID restrictions in Melbourne. You're human, right? So give yourselves a break and see how you go in the next couple of months, but make a concerted effort to be active and pick up those habits like you had before as best you possibly can. And I'm sure that weight will start to come off again. So do we have any other questions about long-term, five years post-op or more? Anything else you want me to answer? I think I've answered everything on the 2 threads. I think. The only one I will address is Tammy's. So Tammy's just posted on one of those threads and said nearly 4 years post-op and have gained 30 kilos back on. I guess it didn't work for me. That is a risk of the surgery. There are people who we call non-responders of the surgery, and it sucks. It's awful. It's heartbreaking to have a few people who you're trying to work with and it just doesn't seem to have the same effect in terms of appetite control or portion control or weight loss. And so Tammy, that may be you, but what I would still recommend is that you go back into your surgeon and you say, look, this is where I'm at. This is what's happened, because again, we can look at those anatomical reasons, go into the GP, we can look at the medical reasons, see your team, we can look at the dietary or the lifestyle, the behaviors that we might be able to fix, and there are some more options. All right, so don't feel disheartened and completely give up, because that's the bit that makes me really sad. We've just got to keep working on it. Okay. All right, so Jenny, I love your positivity, optimism. Most of my friends have put 20 on, so I'm okay with 5. Good. And Katya, great. Go back in, get some medical advice, re-look at those habits, and hopefully that's really helpful. So we're almost out of time. I've been blabbering a lot. Sorry, everybody. It's a big topic. I can't believe we haven't really kind of tackled it so much in the long term. What I might do is perhaps even look at putting a couple of posts together, or a little mini video series together to talk about this as an issue as one, because clearly there's lots of us in that boat now. All right, so we've had, I'm just going quickly back through the posts in the group. I loved Victoria. Victoria said she posted a meme saying, I stepped on my scale, I screamed to stop the count. Didn't work there either. Loved it. That was good. That gave me a good giggle this morning. The weekly challenge this week is to have a little me time and do something that you love, because I challenge you. Most of us, you know, things are getting a little bit easier with COVID. I know you, particularly in Victoria, you guys are obviously sort of getting out, and I wanted you to just go and enjoy yourselves and do something you haven't been able to do for ages. So whether that's go for a walk, wander around the garden. Jacinta's posted some awesome photos of the nursery, so lots of photo ops, which is fabulous. So get out and do something you love and tell me what you've done. Post some photos in there. We've had a few recipes shared. I shared the latest blog post, which was on the intuitive eating and how to start. We've had some funny discussion about making a YouFoods juice. So Vanessa, I don't know how you went with making it yourself, but I thought that was amusing, because trying to get the percentages is obviously what you're aiming for, but how many watermelons or apples or beetroots does that mean you need to buy? I have no idea, because they would all end up with different amounts of juice in them. So if you've got any questions like that around, foods, or Fiona posted about, a product that she'd found in Aldi and asking if that's okay, what would I recommend, then please feel free to post them. More than welcome to do that, and I will get back to you. So I think that's probably about it. Beck, oh yeah, for me it's the little after dinner snack from Habit, Not Hunger, that could go and getting the headspace right again post lockdown. Absolutely. I think we're all prone to a little post-dinner snack when we're not actually hungry, but definitely looking at those little things like that would make a big difference in the long term. And Jenny, lovely to see you. So I hope it's all been helpful for everybody. Let me know if there's anything else you want me to cover. Otherwise, I will let you go, and I will see you again in a fortnight. Okay, thanks guys. Bye.